My name is Dawn Slan, and I am from North Carolina. It actually started, my husband passed away in November of 23 from metastatic melanoma, and he had done traditional treatment. And I had found a lump in my breast, but in the 8 weeks that from his diagnosis until his death, I really didn't bother with that. And I'd probably noticed that a month or so earlier, but I really didn't pay any attention to it. And so I went to the doctor in December after he passed away in November, and they sent me for a biopsy and a screening, and I went, and in February found out that I had stage 1 breast cancer. So the first thing they do is to send you to a surgeon. And we went to the surgeon, and the surgeon did a scan, and he said, before we do that, we just need to make sure it's not anywhere else. So in the process of about a month, I went from a stage 1 diagnosis to stage 4. It was present in my lymph nodes, in my ribs, 2 places in my back, and in my liver. And the only symptom I had was my back hurt some, my ribs and my chest hurt a little bit, and the lump. But as far as feeling bad, I didn't feel bad. I didn't have any idea that I had stage 4 cancer. After watching what my husband went through, I did not want to do. I was not going to do traditional chemo and radiation. I just was not going to do it. And to be honest with you, I had given up. And my son just looked at me and he said, "Mom, you need to do something. And will you please do something?" And I said, "I will. I'll see what I can find." And a friend of mine had actually been to a clinic here in Arizona, and she had come back within a couple of months of having breast cancer as having no evidence of disease. And all these terms were new to me. So NED and stages and all that kind of stuff. It's like word soup whenever you're in the midst of all this. And I had never been to Arizona. My husband had passed away. I really didn't have any reason. My job had ended in January. It was eliminated. So I really didn't have anything but time. And so I researched and I made my way out to Arizona and stayed for 7 weeks for treatment, natural treatment, integrative treatment. Well, I think one of the things that was a shock for me is I was sent to a surgeon immediately and given the option of a mastectomy or a lumpectomy. And neither one of those, I didn't want either one of those things. And then I went from the surgeon to an oncologist in a very clinical setting, and she immediately wanted to start me on some kind of treatment when we hadn't even had a discussion about how advanced my cancer was, what the long-term treatment was. And I was immediately told, "You'll be on this for 5 years and this for the rest of your life." And that was not okay with me. And when I got here, it was almost like a reverse approach. It's like, let's talk about you. Let's talk about how you got here. Let's talk about, is it something genetic or is it something environmental? It turns out a lot of it's environmental. What are you eating? How are you sleeping? How's your head feeling? All those things that did not happen in that clinical manufacturing line setting. So it's like, it was just totally different. Somebody cared about me as a patient and someone who had cancer. And I don't ever want to be seen as a victim, but nobody saw me as a victim. They saw me as someone who they wanted to come alongside and work with and help. Well, I met her when I was here the first time in 24, and she's a naturopath, and that was all new to me. I didn't understand. I had heard the term, didn't really know what it meant. And just in the integrative approach to treatment, it was watching her come alongside of what the clinical side was going to do. So there's a need for some of that. There's also so many natural elements and so many things out there available that I'm not even aware of or wasn't aware of. And she brought that to the table, but it was also the caring and concern, and someone who also, faith is a big part of my life, and it's also a big part of her life. And so having someone you can share that with that didn't think you were weird or strange and didn't, I guess, minimize that, looked at me as a whole person, but just we have maintained that relationship. And even when I left in 24, not realizing that, I'd still be down this road, 2 years later. And I think one of the things that she said to me that has stuck with me and leads me to know that we're on this journey together is that it's not a sprint, it's a marathon, and it's a change in lifestyle. But I'm not on this road alone. She's there with me. She has talked with me a lot about the terrain of my body and what I eat, what you drink, the sources, and there's a lot of things that we don't even realize that we're putting into our body and on our body on a daily basis, and what the impact of that is. And I'm sure you keep up with the news as you see some of these articles coming out and trickling out as people become more aware of the things that we are exposed to on a daily basis. It is important. One of the big things for me is sugar, and that has been something that it's been a huge change for me, but it's been a positive change for me. But it's not only that, it's like the coffee you drink. I'm a huge coffee drinker. Had no clue about the mold and all of the toxins that are in coffees. So that's been a learning process. It's also retraining the way that you think and the way that you do things. But the terrain is most important, because if we don't keep this all as best we can, then all the other stuff will help us, but it's the long-term effect that you want to have in doing these, using supplements and doing the treatments. So some of the treatments that I've been receiving here at New Legacy Natural Medicine and that we do through infusions, I still have a port from a couple of years ago, are the high-dose vitamin C. We do that with artemisinin. I've learned a lot about that. It tastes horrible if you have to do it orally, and it's also not great if you're having to do it this way. You can still taste it. But we do ALA, resveratrol, melatonin, mistletoe. I know that sounds a little strange to folks, but I do the mistletoe injections at home. And then quercetin, curcumin, peptides are another thing that I utilize. I do those at home as well. And then amygdalina. So just a wide variety of infusions. And so the other question that comes up is like, what happens after you do the infusions here? And then I continue some of that with supplements. The high-dose vitamin C infusions I'm able to do at home. I have a resource there that I can access some of that, and so I do those on a weekly basis at home. So when I'm at home, Dr. Rimby and I have it set up now, and we meet once a month, and that's via Zoom meeting. I'm set up on a regular blood draw every 4 to 6 weeks so that I can have my blood drawn and tested, and we discuss those results. She's also available. She has an app, a wonderful app, that if I need have a question for her, I can send her that through that chat, and within a couple of hours, if not sooner, I've got an answer and respond. So there's always open communication. It's not like I go back to North Carolina and Dr. Rimby is here in Arizona and I have to come back out here. We are connected and in contact. When I came back in 2024, like I said, I had some low back pain. I had some, symptoms I didn't realize: fatigue, being tired. Going through that process of the integrative approach and utilizing the natural supplements and the infusions has helped me a lot. I'm able to work out 4 times a week, and most of the time I feel great. I was at a point in December, my numbers on one of the tests that I do, which is a Natera test. It is what they call a liquid biopsy, if you will. And my Natera numbers went from really low, like less than 1, to 9. And that was a big jump in a short period of time, over 3 months. And as it turns out, living in North Carolina, where we have humidity and all those things, my mother's house, living with my mother, had a lot of mold in it, which turns out was not great for her either. So we got the mold remediated. I came out to see Dr. Rimby, and we did some mold. There's an IV that we did that removes the mold from my system. And so in that period of time, I was able to, over those 6 weeks, I had started feeling bloated, and I guess I just felt like I had a lot of inflammation in my body and had started not to feel great again. Within 7 weeks of being out here, I was back to feeling normal. I was feeling good, energetic. I had my energy back. The pain was gone. And so it's been a little bit of a ebb and flow over the 2 years, but I think I'm to the point now that I've got the terrain where I need it to be. Do I have the occasional slip off? I do. Do I eat sugar or cake? I do. But I try to, as soon as I do that, I don't stay in that, and I remember what it feels like to feel really good and to feel healthy. And I think with here at New Legacy, it's just been like now I'm coming back every 3 months, and it's to touch base with Dr. Roomby in person, but it's also the healing that's here in Arizona, and it's also to get some IVs and infusions that I can't get back home. So my cancer numbers, as far as my blood work, is going in the right direction. When I came in January, my numbers were a bit out of whack. Within the 7 weeks that I was here and going back home and getting those numbers again, there's been I think somebody looking at that would think that was a little improvement, but for us, looking and talking with Dr. Roomby, it's a big improvement. There's some definite direction. It's going in the right direction. I'm waiting on some numbers now and a PET scan that I had, but I feel confident that all those things are much better now. I would say to anyone else who has cancer, who has that diagnosis, whether you're doing the conventional route or you're aware of an integrative method and the natural approach, I do not regret 1 minute, 1 millisecond, or 1 dime that I have spent doing the approach that has made me, I've not had any hair loss. I have not had to spend months in bed recuperating because I've had, I believe, the natural supplements that have fed my body what it needed, and at the same time it works to kill the cancer. And I think there is hope, and there's a tremendous hope in a life that you can live. And I think we were talking about this earlier yesterday. When you look at what the definition of cancer is, everybody thinks of cancer as a killer, and many times it can be, but it doesn't have to be. It's an overgrowth of cells. And when you think about how you work to get that overgrowth in place, and you realize you basically put it in its place, and you realize that you have, through natural supplements and through the expertise of someone like Dr. Roomby, working to understand what your body needs and how you can pull all those pieces together to build a life that you can sustain. And like she said, it's a marathon, it's not a sprint. And it's something that we have to spend the rest of our life doing. And it's not like once the cancer is gone, it's gone and you're done and you can go back to the way you're living. It's a lifestyle change and it's a choice. I highly recommend Dr. Roomby and New Legacy to anyone that thinks they might have cancer, that has been diagnosed with cancer. And there's other illnesses too that people have. I just think there's a lot of things you can do from a natural approach that she has the expertise to help with. And I would recommend anyone to give the integrative and natural approach as opposed to the conventional, or in addition to. If you're already in the conventional and you're doing the traditional chemo and radiation, you still need to watch out for your body, because all of those, while they're killing the cancer, it's also destroying other parts of your body, and that needs to be repaired as well.